Francine. I'm so glad you joined us tonight for Autumn is Here. Today we have a special show. We have Dr. Smith, who has a doctorate in clinical psychology. We have Miss Emma Stewart and Miss Dondra Shepard, who are community liaisons and outreach specialists for psychiatric research. They are all a part of Richmond Behavioral Associates. They are here to talk to us about Alzheimer's and the effects of Alzheimer's, and also how it affects caregivers. And we also are going to talk about caregiver depression. So please listen, like, and make sure you share it with your community or your association or your family, just in case someone else may need it. Even if you don't need it, somebody else may need it. Autumn is here. Hello, everyone. This is Francine Crawford. Welcome to my show. Autumn is here. Today we have special guests here from Richmond Behavior Associates, and they are here to talk to us about different things on dementia and caregiving and clinical trial, and we're just going to cover it all today. So we just want to introduce Dr. Smith, who's here. Thank you for being here. And Dondra Shepard, you may recognize her from being here before, and she works in clinical trials. And we have Emma Stewart here, and she is a community liaison and outreach specialist in psychiatric research. So welcome to the show.
Thank you for having us.
Everybody's here today?
Yeah.
We're excited to be here.
Well, thank you all for taking the time out to give information to our audience and give us information and help us to better understand dementia and clinical trials and how social services can help us. So I really appreciate you taking the time. So I'm just going to ask you to just introduce a little bit about yourself. First, Dr. Smith, can you start?
Yeah. So, my name is Adam Smith. I'm a clinical psychologist, neuropsychologist by training, and I've been doing work with memory disorders, Alzheimer's disease, and a lot of psychiatric clinical trials for the last 25 or so years. We're based in Staten Island, but, talk to patients and treat patients all over the metropolitan New York area, and certainly have a lot of experience with the kinds of things that you introduced, like dementia, Alzheimer's disease, and the tremendous kind of complications that come with those illnesses for the families and the people that have to care for these patients and people that are afflicted by these illnesses. So happy to share all of that information that I have, and hopefully encourage people to get help for themselves as caregivers, especially because they're obviously bearing the load of all this kind of care, and it obviously has complications for them, whether they realize it or not. So, just happy to share that experience.
Okay, thank you. Miss Stewart, can you?
Yes, of
Thank you.
course. My name is Emma Stewart. I work with Richmond Behavioral Associates, so I do a lot of the community work with Dondra. And of course, we work in all mental health indications and specifically in memory loss and dementia and Alzheimer's. And then my background is really in therapeutic practices as well for the past 7 years. So kind of integrating that into the community outreach support is really great because we work really closely with the families and really closely with our physicians. So it's really great to be able to bridge that gap and be able to support not only patients that we work with, but their families full circle.
Okay. And Dondra,
Hi, Francine.
hi.
For having us, and it's nice to see you again. Frank and I actually met at a Alzheimer's event in Central Park for Caring Kind. That's how we connected, and ever since we've been collaborating periodically over the last couple of months. You have introduced the team, Emma, Dr. Smith. We are part of ERG, Evolution Research Group. Richmond Behavioral Associates is our location, located in Staten Island, New York. As Emma stated, she and I work very closely with each other across all indications in mental health. And we're just here for support for the community and to educate, more so on clinical trials, but just behavioral health and how to connect people with certain resources when they are not available to them. So we're happy to be here. Thank you.
Oh, okay, okay. So this is great. This is great having all three of you here. Um, let's talk a little bit about dementia and the effects, what happens when someone has dementia, and how do you recognize that?
Yeah. So I mean, I'll try to tackle that first. I
Right.
mean, it's interesting because dementia. Look, first of all, dementia is just a general term for memory thinking problems, right? Then, if somebody gets evaluated, we try and identify what kind of dementia. So the most common type is Alzheimer's type, but there are other types of dementia that are, for instance, the result of stroke or vascular disease, and that's a vascular dementia. So, generally, I just want to get the terms right. So dementia is just a general term for somebody having trouble sort of functioning due to their memory problems. The big sort of take-home point that I want, hopefully, people to remember is that we do have to try and do early detection of Alzheimer's disease. It's the only illness that I'm aware of where from the start of symptoms to diagnosis is at least 3 years. So often family members will say, oh, I sort of noticed there was a little bit of forgetting here and there. Maybe they're repeating themselves, but they don't actually get that person to a doctor for evaluation for up to 3 years of time. So, memory problems start off as very subtle, right? Maybe they miss a single appointment. Maybe they're having they sent a check twice. But as the illness progresses, obviously the functioning issues become more prominent, right? And then they'll not only repeat themselves, but maybe they start having trouble actually doing any, they're not paying many of their bills. They, are forgetting to refill their medicines or take their medicines. And, as an illness progresses, their function becomes, more and more impaired, right? So at the point at which they might start to need assistance to manage around the house, to remind to bathe. I mean, there are a variety of different ways in which people can be affected by dementia. But at some point, it is progressive and things will proceed and they're going to need help. And, it's complicated in terms of where that help needs to come from.
Okay, well, most people, if they do recognize that something has happened, they go to their primary care doctor. So they go to their primary care doctor. In your experience, how much information do they know to connect you to where you're supposed to be at that point? Because sometimes they don't suggest certain things, neurologists or whatever, are the next step. So how, your experience, how aware are they with dementia and Alzheimer's?
Yeah, not as well as they need to be. And so it's really going to require, and first of all, the people that have the memory problem, 80% of the time, they don't think that there's a problem. So that becomes the caregiver's problem, because how am I going to get help for my wife, husband, my mother, my father? And often they will refuse to go to the doctor for that evaluation.
Yeah.
So that's one set of issues that I've heard about, and I try to help people overcome. And there are ways to do that. Primary care doctors, and the other issue is that, many families just feel that forgetting is part of normal aging. And I want to, let people know that forgetting to the point to where it affects, it's not just I went into the other room, I don't know where something, I don't remember what I went into that room for. That's not a memory disorder, right? When things start to affect functioning or you notice, that's where the problem is. So, we want to do an early identification. The patient's not going to go to their primary care doctor and say, I have a memory problem. They're only going to be looking for the things that are on their related to their presenting physical problem. They don't typically assess the mental, including the memory aspects of how somebody's functioning. And that's a big problem. So they're going to need a voice for somebody to bring them to somebody to have that memory problem identified. If you suggest it to the primary care doctor, there's sort of a passivity to what they do because they're just so busy. There's usually an initial memory test that they should do in the office to see if there's an apparent problem, but they should be listening to the family member and hearing from them about how their family member is affected. treatment, so the diagnosis and then the evaluation typically gets done at a neurologist's office. Obviously, at Richmond Behavioral Associates, we do this kind of, screening all the time. But for those that, need to go elsewhere, a neurologist usually will be the type of physician to make that formal diagnosis. Usually there's a CAT scan or an MRI involved. We want to look at the brain to see if there's any cause for that particular memory problem. They look at the medicines, and again, they should be doing a memory evaluation. So, and then, up until this past few years, there haven't been a lot of disease-modifying medicines or medicines that have made a big difference in the course of illness. But, I'm here to say that things are rapidly advancing in terms of diagnosis and treatment for Alzheimer's disease. So I think a lot of doctors and a lot of families are very passive, meaning, it's normal aging. There's really nothing we can do about it anyway. And so, the situation just lingers and lingers. Care never gets initiated. Families don't know where to go. It's just, what we try to do is help, as Emma and Dondra were saying, not only deal with the medical aspects of what is the proper medication for a patient to be on, if there are behavioral problems that start for that person, like they get agitated, easily upset, or withdrawn, we can help manage those symptoms that are very difficult for caregivers. And the team, including Dondra and Emma, will try and really work very hard to get families to the kinds of services that they need to get through this illness, so that they understand they're not the only ones dealing with this particular problem or that particular problem. They can share their frustration so they don't feel so isolated, and also help, and so get families to support groups. And similarly, to get to the persons with the illness to day programs and places where they can stay stimulated and engaged with their illness. So there's a lot that can be done.
Okay. Awesome. Well, it seems like it's a lot on a caregiver, to recognize these things, to take the initiation and take them to the doctor, to speak for them and be an advocate for them in the doctor's office and in their lives, and try to encourage their person to go to the doctor. So how does that work with you, Ms. Stewart? How does that work with you with dealing with the community outreach? What have you seen? And are particular challenges in this, or anything that, has helped other people?
I mean, I think what we see generally is just bringing about discussion. So I think a lot of times people, in not only caregivers, but individuals that are struggling with mental health, there's a lot of stigmas around going to the doctor. There's a lot of stigmas around recognizing when you need help or when a loved one needs help, because it can feel very isolating for people. And I think people also often feel embarrassed to recognize that maybe someone I love is struggling, or that person is struggling, and they, want to ignore it and push it aside. So I think, breaking those stigmas and just building that conversation, to let people know that it's okay to seek help, and that it's actually really great to be preventative, right? The faster you are at receiving help and acknowledging that there might be something that you're struggling with, the sooner that you get that care, and it's not going to progress past a point where you feel hopeless. And that goes for, an individual that's struggling, and that also goes for caregivers. Once you recognize that someone may be showing some symptoms and they don't want to seek help, it's about starting, breaking that problem down into really small steps. So just starting the conversation. So maybe it's not, we have to go to the doctor right away, because that can feel intimidating to the individual, but maybe it's, starting to just talk about, how have you been feeling lately? Maybe it's breaking it down into, have you been struggling with that? I've noticed that it's taken us a little bit longer to get through this. And then, building up that conversation so that it's less daunting, I think can sometimes be an easier route into getting someone to seek help, and starting that slow process of seeing a doctor or seeing a counselor, or seeking any service that person might need. So kind of breaking it down, making it feel less scary. And then also for caregivers, it's less daunting on you, right? Because it can be very overwhelming, the entire process, but especially starting the process when you don't know where to start and you're starting to notice symptoms that can be scary for you as a caregiver if it's, your loved one, and scary for them. So I think breaking things down into really small steps can make the entire process feel less overwhelming. And it doesn't mean to slow down the process. You don't have to make these steps go across years and then not seek the support that you need, but it can just be the mental process of saying, today we're just going to tackle talking about one thing that might have been a struggle. And then we move on to the next thing. And then saying, I tell people, even if you're making something up, try to be relatable to another story. You can tell your loved one, someone else I knew was struggling with that. And what really helped them was going to see this doctor that I had heard of. Or, it'd be really great to talk to this person that was experiencing something similar, without kind of putting a diagnosis on that loved one and saying, like, I think that you might be struggling here or there, but kind of making it more relatable and saying that, I know someone that kind of struggled with a similar thing, and maybe we can just get their perspective on it. And then that kind of eases people into seeking care. Again, it's a really scary process. And, you know, you think even when you have to go to the doctor for something minor, it can be really daunting and you push it off and you say like, oh, I don't really need to go and I'll go next time. And so I think inherently we all are very avoidant of taking care of ourselves, but it's really important to recognize where you need support and where things feel scary for you and kind of integrate that into the conversations that you're having with other people that might be struggling with, symptoms that they're trying to understand themselves.
And I think it's a great point. I think there still is a ton of stigma associated with memory disorders and Alzheimer's disease, even just saying that word.
Yeah, absolutely.
We have really a long way to go getting people feeling sort of comfortable like any other illness.
Right.
Do you see any difference in the community as far as who comes to you? Like, is it more reluctance and less participation in communities of color, or the awareness of it is different in communities of color? Is this for Ms. Stewart?
Yeah, I mean, I think that even speaking in my own neighborhood and I live in Brooklyn, I feel like when we look at different communities, we also look at where resources are available. So, a lot of communities of color just have a lack of uh memory centers and stuff within the neighborhoods. And also we talk about where education is. Like there has to be education around what memory loss looks like. There has to be education around what dementia and Alzheimer's even is. I think there's stigmas around even when we're looking men versus women, I think there's reported a lot more cases of depression in women. But is that accurate, or is it also because there's a lot of stigma around men acknowledging mental health struggles? So I think there's, always discrepancies in who we see coming forward and who we see getting support. A lot of times, it's women that are the caregivers, just statistically, at least in the United States, it's, mothers and daughters. So I think those are also people that we're seeing that come forward when recognizing symptoms. So I think most of the time it's also families that do have mothers and daughters present in the life as a caregiver. We'll see them come forward more often.
Okay. And how does this help? You deal with clinical trials, Dondra, and how does that help in bridging the gap, or how does it assist people in knowing more about these diseases?
Yeah, so clinical trials, it's just like any other area of medicine. You have to use it as an additional resource. It's not for everyone, but it does provide hope. So whereas you can go to your doctor and maybe you are prescribed antipsychotics, antidepressants, and they may not be working for you, where clinical trials come into play is that we provide therapies that are not on the market as of yet. So we're still going through the trial process of the medication, of the therapy, and it may work better for them better than what they have already been receiving or taking for a couple of years. So again, it's all about the awareness. Again, there is a lot of stigma around clinical trials in itself. The word guinea pig is used very often. We have to get beyond that. But yeah, it's about providing hope. And again, we
It's also providing access, right, Dondra, because for like in psychiatry, for better or worse, mental health
right,
is still so hard to access. And we do have quicker access.
exactly.
Yeah, go ahead.
Yes, quicker access to certain therapies. And that's where it's important to have my role as a clinical research, a clinical outreach coordinator is to educate and to provide those education to communities that may not be aware of the services that we provide or just need more explanation or bridging the gaps as far as connecting other outside organizations. We can't do it alone. We definitely rely on our community partners. So, um, again, if we can't provide what that person is looking for, we would definitely try to connect them to someone in their area that could be beneficial to them in their mental health journey.
Yeah, specifically like Francine for Alzheimer's disease. Really, it's only through a clinical trial that we have access to some new diagnostic tests that just aren't available, yet through clinics or regular doctors. So they've even developed some new blood tests that probably will be on the market in the next year that give us actually a look into the brain to see if there's this amyloid plaque that's responsible for the Alzheimer's disease. That's not available if you've got a regular doctor. Right now, also the only other way you can make a definite diagnosis, do a PET scan. Not easy to get approved and probably, more difficult to get, through certain, in certain communities. So we do have access that's available where that might not be present if
Right.
it just went to a regular doctor. So I think to Dondra's point, yes, the normal run-of-the-mill depression or, or anxiety disorder may be well managed by a primary care doctor.
No.
Patients don't do well on certain meds or they haven't responded. If it's psychiatry, like depression or anxiety. But for those that are more difficult to treat, like Alzheimer's disease, clinical trials do have access to interventions that are just harder to get access to if you're the standard, clinician has access to.
And we talked about that during our last segment with the Eli Lilly trial there was a certain blood test that we did that looked at the p-tau protein. So that test isn't available if you go to a LabCorp or a Quest Diagnostic or your primary care physician's office. It's only tailored to that specific trial. So,
Yeah.
again, that's the beauty in clinical research.
Well, and then also, right, some of the treatments that have recently been approved
Right,
for Alzheimer's disease are not being rolled out into the community for
right.
various reasons related to healthcare coverage
Uh-huh.
and so forth. And so, some of these marketed drugs we even have access to. So it gives, people an opportunity to have these treatments where it just might be harder to access otherwise. And so, I think that's worthy of a look. I mean, if you were in a hospital and had cancer and it was sort of an advanced cancer or something, clinical trials are continually being referred to help people with, serious medical diagnoses. And that's how we got every one of the medicines that we have today. But I know the history of these kinds of clinical trials have been mired in abuses of the past and specifically impacting, communities of color and disadvantage. And so, I think part of the role of our outreach people is to kind of just have the communities, recognize that things have come, very far in terms of how we educate and how we, protect everybody's interests when we institute or, make these things available to them.
Mhm.
That's one of the things that I want to make sure that people just remember that clinical trials is not anything new. We've been doing this for years for different drugs, and the drugs that you take today had to go through different testing like clinical trials, and that's the reason why you're able to take these drugs. So it's encouraging for people to participate because you're kind of paying it forward. It may not be for you, it may be for, 10 years, 20 years down the line for people in your family or whatever that may have these diseases, and it'll be easier for them to deal with and maybe even a cure at some point. So
Yeah.
trials has been around, and they are working to make things safer and more available to more people. So that's
Yeah. And Francine, I would just say, not even 5 to 10 years down the road, things that we work on very late stage things. So this isn't early stage research. This is like this stuff has already been demonstrated to have some effect, and they have a pretty good awareness of what the side effects are. So usually it's the last stage before FDA approval.
Okay.
And so, sometimes it's the matter of a year or two before these things could be available. But nobody, whether it be standard medicine, and we all know this, going into a doctor's office, there's no, absolute, guarantee of anything. But what we try to do in addition to this is do the kinds of support for caregivers and for those individuals affected to make sure that there's an overall sort of education and referral to the kinds of resources that they need. I mean, we're clinicians, so we're responsible for helping people, whether or not they're part of a trial, and to get them where they need to go. And it's not all about medicine. I think we know that at this point. You have to get people access to other resources so that they can, kind of develop the general health behaviors. We need to help the caregivers and with memory disorders. I mean, the days of just kind of focusing on the illness as a medical disease isn't really good enough today.
Right.
Mhm. So there's one point that I do want to talk about. I want to talk about it's a lot for a caregiver. And I know that because I've gone through it, not ever really knowing that I was a caregiver. I was just taking care of my mother, never knowing the term, actually. But one thing I want to talk about is caregiver depression. Now, that came up for in our other interview, and I wanted to talk about that because I didn't realize that that's a thing, and it can be something that people overlook and may be able to get help for. So can anybody speak to that? Would you like to speak to that? I don't know.
You guys, let me know when
I mean, I think just in general, being a caregiver is all encompassing, right? So I think a lot of times people aren't prepared to be a caregiver because things can be very quickly onset with symptoms with a loved one. And also, I think when we look at caregivers, we're looking at sometimes they are outside organizations, but a lot of times they are loved ones. They are, again, daughters, sisters of a loved one, wives, mothers. So a lot of times these people are not only doing all the work of being a caregiver, which is very taxing, right? It's sometimes around the clock care for symptoms that can be very difficult to manage. And so we're talking about, a lot of agitation. We're talking about a lot of physical work taking care of someone. Someone may not be able to move as much as they were able to before. So it can be heavy lifting, working with a lot of emotions, unpredictable emotions. And so I think that in itself can be very taxing on an individual. And then not only that, but as a loved one, you're watching someone go through all of these changes, and you have to deal with it internally while also caring for someone. So you're doing all that work while also having to recognize all of these changes and struggles within your loved one. And so I think it's really hard for caregivers to take the time to separate those two, to separate the work from the emotion. And a lot of times I think they don't even have the chance to separate the two because all of the work that they're putting in, and maybe a lack of resources of when they're able to step back and take a moment to themselves or seek the support that they may need to, or even a moment to recognize I myself as a caregiver may be struggling emotionally and don't have the time to even recognize what those processes are in my own brain. So I think when we look at caregivers just in a general sense, it is separating those two things of someone that's experiencing a loved one going through hardship and a lot of change, and then also themselves working really hard to support this loved one through, you know, could be years of support. So
How do you do it? Go ahead.
How do you recognize that? How do you recognize if you're going through some sort of depression?
Cool.
Caregiver.
I can handle that. So
Yeah.
it's look, if it's your mother, you're also working and trying to manage your life. So what are the symptoms of depression, right? If you have impairment to your sleep, right? You're not going to be able to function as well the next day. And so people, right, because they're caregivers, because their loved ones up at night, they may not be getting enough sleep. But depression is a combination of, right, not eating well, either too much or too little, not sleeping enough, or sleeping too much, which really will never happen in a caregiver situation. Feeling tired, not having much energy, right? And so some of these things are going to be hard to distinguish from just the physical and emotional and time impact, right, of being a caregiver. But there's also a lack of interest in terms of things that people used to like to do, so they don't really have much motivation. And they also might have trouble concentrating. They just feel scattered all the time. People think of so people think of depression as sadness primarily, hopelessness, feeling discouraged all the time. But it's also irritability, right? So it's being way more short-tempered, more reactive. And as a caregiver, you're going to be challenged a lot. So being irritable a lot of the time is also going to be a challenge. So the question is, some of these things that I've just mentioned are a normal, let's just say, at a low level is just part of being a human being, right? We all have nights where we don't sleep, where we, don't eat because we don't have time, and we just feel tired because we're racing and running around all the time. But at the point at which, our functioning is affected, where we're not getting to things, we're disorganized, we have, we just feel sad, and, our situation feels hopeless, and we're just negative about everything all the time. If we have an opportunity to go out, we don't want to go, we just prefer to stay home. All these things are suggestive, right, of possibly having a depression. And so, I think it's ultimately just a question of having that conversation with someone, either and a physician, a counselor, maybe a support group member, to try and understand, how impacted are you by these feelings that you're having. There's no blood test for depression, right? But it's easier also to see it in other people than it is in ourselves. As you said, Francine, at what point might I have felt sort of hopeless, or felt so overwhelmed that my life, was really being affected in a way where I wasn't able to sort of function as well as I would have liked. That's that's a discussion to be had for sure.
Mhm. So support groups and even not necessarily just outside support groups, but family members, or just having someone to exchange and talk to. So what I'm hearing is, try not to isolate yourself. Even if you're busy, you're going through stuff, make sure you have that connection with someone. So even if you don't recognize it, someone else may recognize it in you.
Absolutely. And look, as you said, Care in Kind, all these, there are a bunch of local organizations, the Alzheimer's Association of New York City, all these places have support groups, and they do even have many online. So when you are limited in terms of distance or, time, there are ways to get access to these support services. And these people who are in your communities will know also about other resources. They've been through it. You'll see people at various different stages of illness. So they help you with the practical as well as the emotional, because they also have been through it in both respects. Uh, and they normalize, the kinds of things that you think that you're having trouble dealing with. And it just not feeling alone often is a big help to a lot of people.
Mhm. Okay. Well, thank you. Is there anything else that you would like to share? Either one of you would like to share with the audience that maybe is something that we overlook, or something that's new that no one knows about? You want to tell them, or dispelling any myths or anything like that? With anybody like to start with that? Closing
I will say, yeah, just one thing that I had read about once that I think is important to know is that when someone is a caregiver for a loved one and that person passes away, I think it's also important to note that if you were experiencing symptoms of depression and you were experiencing, that hopelessness, when a person passes away, I think statistically it was that a caregiver that was a loved one that was caring for them will experience depression for up to 5 years after that loved one passes away. And I think it's important to note that, sometimes people think, well, now all of the weight has been lifted off of me as a caregiver, but then now you're not only experiencing grief, but all of those feelings and the experience that someone went through as a caregiver doesn't disappear once that role has stopped for them. And so I think it's really important just to advocate for yourself and for others, because many people, if not most people, will experience knowing someone with memory loss or dementia or Alzheimer's. And I think it's just important to keep the conversation going as a whole and to just advocate for the awareness of mental health support even after, because if you know someone that was a caregiver and then that loved one passed away, to not, you know, forget to keep checking on them, forget to keep pushing them to take care of themselves, because all of those feelings and all of the weight and all of the guilt and emotion that you put into that role doesn't disappear. So just making sure that you stay on top of being an advocate for others that might be experiencing that and checking in on people that may be experiencing that, and for yourself, just keeping that in the back of your mind, because we all might experience that one day, and it's just important to recognize it earlier on and have those conversations ongoing.
Okay. Okay.
Yeah, I would say seniors in general, and everything Lana said is so true. It's seniors, though, generally are so much more vulnerable to depression. Just, not only in a caregiving situation, but their friends, their families moving away. There's so much isolation today. The physical problems that impede people from being able to live their lives as fully, right, if they have a chronic medical illness. But my one piece of advice is I've never seen a problem go away on its own generally, right? If you have a problem, deal with it. It usually never gets better by itself, right? Unless it's a simple, cut on your finger, right? Those kinds of, but every other sort of emotional or psychological problem, very, very rarely, if ever, I've seen a problem go away just by doing nothing. So to be as proactive as possible and get over that, try and figure out, and it's hard today because it's hard to know how to access services. I'd say at least, you called here, somebody will pick up the phone and try and, do something to help people get to the right place. But there isn't a lot of that, right? Our healthcare system's so fragmented
Right.
and again, mental health, so difficult to access resources. But recognize the problem and just do your best to try and find uh, some place to deal with that.
Okay. Okay. Dondra, would you like to?
Yeah, I mean, they pretty much covered everything. Definitely having a sense of community. We all live in society together. It's very important to check on your loved ones, make sure everyone is okay. Educate yourself. And if you can't, find out how to navigate the healthcare system yourself, there are people out there that are available to help. Just as Dr. Smith said, we may not have all the answers at our location, but we're willing to point you in the right direction if we can't provide those resources for you or that help for you. Yep.
Thank you. Thank you all so much. I really appreciate you taking the time and giving all this great information and different perspectives of how to look at things in Alzheimer's and caregiving and things like that, and especially clinical trial. And just reminding people that clinical trial is a way to pay it forward. You know, people have done it for you. It's a way to play it forward. So thank you so much. I appreciate it. And I just hope that we get better with finding out about Alzheimer's and dementia and these diseases, and I'm sure eventually there will be a cure. I really believe that. Thank you for taking the time.
Yeah, thank you so much for having this.
Good seeing.
Take care.